Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
And today we'll be talking about osteoporosis and your pelvic floor.
Let's do a quick anatomy review. Not a single muscle attaches on the femoral neck. In order to build bone, there needs to be a tensile force on the bone. Think about Wolff's Law. If no muscles attach on the femoral neck, then this makes it a very compromised spot as we age. You can bet that the pelvic floor muscles will overcompensate and get tight to support the weakening hip. And we've all seen increased incidence of stress urinary incontinence in our patients with osteoporosis. We most likely have attributed increased rates of SUI with aging and low estrogen. Well, the International Journal of Environmental and Public Health did a study looking at exactly this. They found that participants with osteoporosis experienced a higher risk of SUI. You can see the link to the study down below. And most importantly for NPs, they strongly recommend that we screen for SUI in our patients with osteoporosis.
The mechanism by which stress urinary incontinence increases in women with osteoporosis is unclear, but there are two hypotheses, which makes sense if we think about it. Decreased bone mineral density, osteoporosis, fracture, is the result of defects in bone connective tissue, which could compromise pelvic floor muscles. Decline in height as we age, a decrease in height causes increased intra-abdominal pressure, which can lead to urinary incontinence, epigastric pain, and hemorrhoids. And then changes in spinal curvature and compression fractures of the spine result in an increase in intra-abdominal pressure by pushing on the pelvic floor muscles.
Your bimanual exam, identification of hypertonic pelvic floor muscles, and assessment of pelvic floor motor control are crucial in giving your patients the appropriate pelvic floor exercises. Diaphragmatic breathing is always a great place to start.
And then providing your patient with closed chain exercises, such as brisk walking, will help improve their pelvic floor muscle activation and support their aging pelvic girdle. Walking is generally the best form of exercise for osteoporosis and increasing bone mineral density in the hip. In order to build bone, closed chain exercises are needed. So that's not cycling or swimming. Those are open chain exercises. And focusing too on hip external rotation, because those are the muscles in the pelvic floor that connect right on the greater trochanter, right next to the femoral neck. And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and comment below to let us know your biggest challenges in providing care for your patients with osteoporosis.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. You'll get access to our weekly pelvic health content.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. We're super excited to announce we're developing an online pelvic health course for nurse practitioners.
Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.